Medical professionals overdid it. When did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? Probably too late to the party, but I had a lady come into the listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me. Rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to losing muscle fibers. Her calves were incredibly swollen and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar. No surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my crap together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. In dental school, I had an emergency patient come in, complaining of sore gums. Upon examination, I found a massive calculus bridge. Google it for pictures behind her lower front teeth. She only had about 3 remaining lower teeth, but they were all connected with a whitish brown mineral deposit that was about the size of a golf ball. She had never had her teeth cleaned and she was probably 55 or so. I basically performed an emergency cleaning. She could speak so much better afterwards. Of course I had to play it off like it was normal, but in my years of practice I still haven't seen a case that bad again. Get your teeth cleaned, people. Even if you can't afford every 6 months, once a year, or every other year is a heck of a lot better than never. 5 years ago I spent 6 months working in a small rural Zambian hospital in the medical ward as part of a volunteer outreach program. I have done mostly family medicine, some surgery in my early days, but decided to mix life up a bit. The hospital was typical third world, a few basic medications, rudimentary clinical tools, a small lab on site which was usually broken, no resuscitation tools whatsoever. HIV, TB and malaria was rife. It would not be uncommon to encounter a death per day despite our best efforts. On one of my first days there, an unconscious person was carried in by a mob of locals. I could smell him before I saw him because he had been in a house fire and his skin was cooked, completely black around his chest, face and over his legs. He was still breathing on his own and maintaining his airway, but we had no doubt he had inhaled a lot of smoke. With no way to intubate or provide oxygen, we merely had to hope that he didn't swell up and close off, and deal with the rest of the burns while he was unconscious. 2 colleagues who worked in the hospital came over urgently. We all kept our cool externally and got the nurses to translate to the man's family that we were going to do everything we could to get him better. In reality, all 3 of us knew his chances at survival were in the single-digit percentages. We decided that due to the extent of his burns we were going to have to do an escherectomy, cutting the burned skin to prevent it contracting and stopping him from breathing. Turns out I had the most surgical experience, so despite having never done one before I gave it a go, hoping for the best. We got an IV into a neck vein and got fluids going. The local nurses dressed his burns. We gave him whatever pain relief we had. He was unconscious for a couple of days but eventually came to. Each day we were expecting his kidneys to pack up, but to our surprise, Gradually he got better. He was with us for just over 4 months recovering. He came out severely scarred, but he had beaten the odds and survived. I showed up to a house for a possible overdose. 3 firefighters and a police officer were on top of a man who was prone and naked from the waist down. They immediately told my partner and I to restrain the patient to the gurney because the patient was combative. It turns out he took something thinking it was weed, but turned out to be laced with something else, possibly PCP. During his trip he attempted to cut his dong off, but wasn't successful. As fate would have it, I knew the patient personally and tried to comfort him on the way to the hospital. During the ride he became somewhat cognizant and was ashamed of himself. I tried to comfort him as I held his dong in place. I would be lying if I said I had seen a severed dong before. I'm a nurse and I work in a pediatric. A young woman brought her baby in to be seen for vomiting. I asked her to put the baby on the scale. While on the scale I noticed a strong odor of bug spray, so I asked about it. Mom, a roach crawled into her mouth, so I sprayed a little radon there. She said it matter of factually like it was no big deal. Q calls to the police, CPS and a one sitter for the child and the mom. When all was said and done the baby was fine and turned over to her grandmother, so no worries there. I have no idea what happened to the mother. I don't believe she was intending to hurt the child. I think she was just completely ignorant. I worked as a mental health tech to get through undergrad. 15F in the adolescent ward claims to have swallowed a staple. But whatever. As I'm taking her down to x-ray I tell her about the dime I swallowed when I was a kid. It happens. Well, turns out she underestimated the number of staples by around 100. Every printout given by the therapists had been a swallowed staple. She had gotten staples from the other kids. The x-ray of her abdomen looked as if it were a weird staple-y snow globe. And yet, somehow, she was back to trying to steal psych ward staples a week later. Never did figure out how they removed them all. With a staple remover. Not the worst, but I had a patient once with a stomach bleed and a small bowel obstruction. We had to put in an NG tube that goes in your nose and down to your stomach, to drain decompress his stomach, which was pretty distended and hard. I'm inserting the tube and as soon as it hits this guy's gag reflex he projectile vomits and sprays very dark, half-digested blood all over himself, the bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally finish placement and it immediately suctions out 3 liters of this black sludge that is old, digested blood. PT was mortified and we had to play it off like, oh no it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up. My co-worker and I left the room and just stared at each other in silent shock. Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter because sometimes kids chew their gums because it's numb and feels weird. So the drive home took 30 minutes and I had been talking to my daughter the entire time to keep her busy. I park my car in my driveway, opened the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now. Not a medical professional, but a story about my father. After years of a blood disease, his spleen had to be removed as it had swollen to a size that made breathing difficult. Apparently the surgeon had a photo taken, post-extraction, where he is cradling my dad's 22.0 lb spleen. To top it off, one day into recovery, when doing one of those gentle push on the abdomen type exams on him, my dad's sutures catastrophically failed and he let loose a spray that coated the doctor, his nurse, and a good portion of the ceiling. Luckily for dad, the hospital staff was on point that day and kept him alive despite his body's best effort. I heard all of this from the doctor while he was removing the line of staples that went from crotch to sternum. Some weeks later, dad didn't like to share, apparently. Had a patient who needed a lower G study to fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, "I kinda want to try and poop." He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. I will share this particular story with my legs crossed. Motorcyclist came in after someone left turned without checking. He had gone over the hood, slid and somehow somersaulted landing on his butt sitting up. He slid across intersection mostly on his butt, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and butt when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his butt. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. One guy had a dong inflammation, was like 14 inches long and 6 wide. I could practically sense the pain. A huge subset of the population we treat are uninsured, blue collar, low educated people, a lot of smoking and diabetic non-compliance, that sort of thing. Therefore we end up seeing a lot of what happens with diseases if you never treat them and let them run their natural course to end stage. We've had so many diabetic foot and toe amputations I've lost count. However, one lady that sticks out had a huge area of loculated, necrotic tissue on her low back. Usually you'll have a foul smell and purplish black overlying tissue to tip you off. This lady's back had several areas that got so gangrenous and necrotic that there were basically just large pockets down to her subcutaneous fat and muscle. The appearance resembled a sponge with large holes that was filled to capacity with pus. The smell was indescribably atrocious. What made it worse was every time we cleaned out a pocket, we would probe with a finger and it would lead to another freaking pocket of pus and the smell would double up again. Unfortunately she lost nearly all the skin on her low back down to muscle bone in some places. We slapped a huge wound vac on it and she ended up being shipped out to a specialist center. Took forever for the smell to leave my nostrils. My aunt started her nursing career in a county hospital, which means you get all the homeless folks. A guy came in with the whole of the back of his leg and butt utterly and very deeply infested with maggots. He just hadn't gotten around to coming in earlier, he said. The depressing thing is that while it was a first for my aunt, it was by no means the last. Apparently it's more common than you think. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me, he just wanted to check. It was just, well, not to Q jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I'd make sure someone was with him right away. How the frick can you be so nonchalant about crushing your fricking thumb into oblivion? I was the patient actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg. and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one heck of a poker face. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Third time's the charm. I worked as a tech in the ER for a while and had a woman in her 40s present with burning and pain down below, discharge and a bad smell. I got the cart set up for a vaginal exam, got her vitals, blood and urine. She couldn't be because of the pain, she said. All the basic jazz you do when someone comes into the ER. I process my samples and let the nurse know everything is done, and she goes to talk to the woman and it essentially goes as this. No, she hasn't had any trauma. No assault. No, she doesn't know what's going on. But it started about 3 weeks prior. Long story short, we get the doctor as the woman refused to let the nurse take a look, and we are all in the room when the doctor turns the light on under the drape and immediately asks if she's been using any medication vaginally. There's clearly a lot of irritation and swelling as well as a very strong odor, and she hadn't even inserted the spec yet. The woman says no, nothing. At this point the nurse goes to get some saline and I'm left to hand off tools and handle any swabs. The first swab handed to me was literally tinged a pale green. Clearly infection. I'm capping it and the woman smells the odor slowly filling the room finally and starts apologizing. I had to say while trying not to gag, no need to apologize. I've seen much crazier things. Just relax and we will get you all fixed up. Well, the nurse comes back with saline and the doctor starts essentially flushing this woman's vagina, trying to clear out all this discharge and infection so she can see what's going on. And all of a sudden she stops and asks if she's sure she hasn't been putting anything in her vagina to treat any medical condition, even something not given by a doctor. And that's when we found out for about a month. This woman had been douching with a bleach and water mix to try and cure a yeast infection. Because she read that in hospitals we wash down with diluted bleach to kill germs and thought it would work. She was riddled with chemical burns and infection and was immediately transported to a bigger hospital. So yeah, that happened. I mean, yes, Monistat is uncomfortable, but that's a heck of an alternative. Genital warts the size of grapes on the guy's dong. Quoth he, the ladies never complain. I'm an oncology nurse. The other day I had a patient who had a nosebleed that just would not stop. I gave him an extra infusion of platelets, vitamin K, and multiple doses of Afrin, nasal spray which vasoconstricts. It would stop for maybe 20 minutes before it would start bleeding like a faucet again through the family's pinching fingers. The whole time nosebleeds are common. It is the dry air from the heater act. I ended up personally holding his nose for over an hour while straight we waited from someone from ears, nose, throat to show up to pack it. He lost so much blood he needed a blood transfusion. My arm was so sore and the patient looked like he had been murdered twice over from all the blood on his clothes. Not a medical professional, but my mom is an RN, and boy has she had some stories over the years. Yet, one in particular stands out. She had a male patient come in with extremely swollen dong, like the size of a Pringle can swollen. She said it was the biggest dong she ever encountered in her decades as a nurse. He claimed he broke it during intercourse. She had to put a catheter in. The guy was freaking out and she had to reassure him that this was a walk in the park for her. But she was seriously questioning how to get the catheter in. She called in her co-worker to help steady his dong. Well, also so someone else could just witness what she was seeing, while she gave him every painkiller she was legally able to give, and stuck the catheter in. Got it in the first try, thankfully. She still doesn't know how she managed to get it in but was thankful she did. Eventually it came out that he hadn't broken his dong during intercourse but actually masturbated after cleaning his fish tank without washing his hands and got an infection from it. When you empty a fish tank you use a suction hose that functions eerily similarly to a dong pump, and I bet that is the real story. I am a surgical tech. I got called in on a Saturday for a lady who had an infection from a component separation. Basically they put a giant piece of mesh in you for hernias. I wasn't prepared. When we lifted up her gown, the smell wafted and I have never almost puked before until that moment. About 20 centimeters circle around her umbilicus was black and necrotic. It was absolutely awful. We basically removed the entirety of the necrotic tissue all the way down to the peritoneum. Just grey and black slimy mass of fat and skin. The worst part is that I had to measure the necrotic tissue and it requires me to lean in a little close to it. The surgeon was laughing because I was green when I got back to the surgical field. I had to see an orthopedist oncologist because I had 2 sarcomas. One in my left thigh and the sciatic nerve and one in my left pelvic. My surgeon said he would get both out and the most I would get would be a drop foot, where you can't lift up your foot on your own. I went back 2 years later and my doctor told me he thought he would have to remove my leg because of how the sarcomas were enmeshed in my bones, muscle, and nerves. I honestly thought the whole time that it was an easy out, though the 2 10-hour surgeries may have been a clue that it wasn't so simple. These days I have a limp as I'm missing half my left pelvic bone and most of my glute and thigh muscle, but I got to keep the leg. A patient with rectal cancer with an exposed colon and rectum. I could see her tailbone and in the head of the femur, and whenever she would poop, it could collect inside this open cavity and had to be flushed out. When I was a med student on the trauma service, there was a gentleman who decided to end his life using a shotgun aimed at his heart. Unfortunately, the first thing that comes out of a shotgun when it is fired is a gust of air, which changed where the gun barrel was pointed when the shot came out. The shot pellets ended up hitting everything but his heart, lungs, ribs, spleen, stomach, liver, pancreas, and large and small intestines. In the OR, the attending surgeon told me to put my hand on his beating heart because that will likely be the only time in my medical career that I would touch a beating heart. I did. It was cool. He survived, though. He was on the trauma service for the entire month I was there, and was in the hospital for a long time further. Not my story, but my so was in training as a nurse's aide. On her first internship, she was assigned to the ER at a trauma center. The first person, on her first shift, of her first internship of 3, was an older homeless man, complaining of his foot hurting. After the medical staff took a quick look at the foot, they didn't initially see anything wrong, so they tried to remove his pants to examine the leg. The pants didn't move. They were fused to his skin from the middle of the hip all the way down to his calf. They had to surgically remove his jeans by basically cutting the skin around the point where it was fused. At the moment the scalpel made the first incision, she described it as if Slimer from Ghostbusters barfed out of his leg. Apparently, there was enough gushing, green fluid, filled with maggots, that it covered the floor in the small examination room, and the nurse ran out of the room gagging. After getting over the initial shock, they managed to peel a good amount of the skin off with the pant leg, and revealed that his lower leg had basically rotted all the way to the bone, and was full of maggots. Apparently that's the moment when she knew she was meant for the job. Even the surgeon was having a pretty hard time keeping his composure, but she was fine, more fascinated than anything, and apparently not affected by bad smells as most people are. They had to tell him his leg was going to be okay. He was severely mentally ill and might have freaked the heck out, despite knowing he could die from the infection. Apparently he survived and they managed to save the leg, which is beyond incredible. 4th year med student here. On my rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room and I'm immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient is to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and dong are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his dong. The nurse had a speculum, tool OBGYNs used to look inside vags, inserted into the man's foreskin while the resident took the catheter in a hemorrhaging pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pea crap. I still don't know how he let his scrotum and dong swell that much. We comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ED had ever done or seen anything like it. Obligatory, not a medical professional, but a first aider. I was doing a duty at the finish line of the London Marathon, as I have done for many years. I've seen enough chafing, dehydration and blisters galore. Someone always has the worst of the day, but it happened so fast that you can hardly mentally tally whose nipples were the most raw. Until I had a runner come in covered in blood complaining that her nipples had completely gone. She had chafed so bad that her nipples and areolas were rubbed to nothing. And the worst part was that she had her nipples pierced and the piercings had embedded themselves in her exposed breast tissue. I had to talk her through sterilizing the wounds while trying to assure her that it happens to everyone. The image of a nipple bar peeking out of red, raw breast tissue will haunt me. I was a fat little 10-year-old with a slide on a float in the middle of the lake. We had a bucket on a rope to pour water on the slide before you went down. I missed a spot. My right nipple very literally was burned off by the hot plastic. It took years before it became somewhat normal again. You have been visited by the ingenious Joe. Comment brain so you always see the glass half full, like and subscribe, you magnificent person.